So now we're just going to wait a bit for people to join in to the Zoom meeting, and we will start shortly. Yep, great to see there's a diverse group today. Hello, welcome everyone. If you would like to say hi, where you're from, into the chat box, always welcome. Oh, I see our uh, Western Pacific regional hub lead, Hazel, is also here. Lovely. Of people from Vancouver, New York. And again, very sorry that I'm not that familiar with the daylight saving time. It's a very bizarre thing for us in Asia. Oh, and our program director for the Nursing Now Challenge, Aisha Holloway, is here.
It's a very bizarre thing for us here as well. It happens twice a year, and every time it's bizarre.
You can see some familiar names. So we will start shortly in 2 more minutes. Start off 9:05. I hope you're all ready for today's session. It's gonna be amazing. Lovely. We have audience from all over the world. This is fabulous, and that's what we like to see. We like to see the connection, bring the whole world together on this very, very important subject. So I guess I'll start by introducing. So good morning, afternoon, and evening, everyone, wherever you are. It is with great pleasure that I extend a warm welcome to each of you joining us today for this webinar. Designed as part of a series aimed at empowering early career nurses and nursing students in the Western Pacific region and beyond. Together, we aspire to broaden our understanding of nursing and education, transcending conventional boundaries to explore the nuanced facets that define our profession. I am honored to introduce our distinguished guest, Dr. Olga Yakusheva. Dr. Yakusheva is a renowned economist and professor of nursing at the Johns Hopkins School of Nursing. She also serves as the economic editor for the International Journal of Nursing Studies. With a strong academic foundation in mathematics and economics, her expertise in economic theories, methods, and big data analytics is internationally renowned and recognized. Dr. Yakusheva's pioneering research focuses on elucidating the economic value of nursing, highlighting its profound impact on patient outcomes and organizational effectiveness. Recognized as an honorary fellow of the American Academy of Nursing in 2023, Dr. Yakusheva plays a pivotal role in shaping national nursing policies and advises prestigious organizations such as the ANA Enterprise and the Joint Commission's Nurse Stakeholder Committee. Her recent initiatives include spearheading efforts to articulate the economic value of nursing and pioneering innovative payment models for the nursing reimbursement. I had the privilege of meeting Dr. Yakusheva during her visit to Taiwan last October at the Symposium on the Economic Power in Nursing, hosted by the Taiwan Nurses Association. Her insights on the nursing human capital value model and education for value-informed nursing practice have deeply influenced my own perspective. Dr. Yakusheva's unwavering dedication to advancing nursing economics is not only transformative, but also indispensable for shaping the future of nursing practice and education worldwide. Please join me in giving a warm virtual welcome to Dr. Olga Yakusheva. Is there is Olga still with us?
Mm, looks
We
like she
had
might be
this,
frozen.
yes, we had this kind of Zoom technicalities last time too with the the previous session. But yes, I think Olga will be back with us very soon. So please wait for a little bit.
Hopefully she'll be back with us soon. I'm really fascinated to hear her biography. And as someone who enjoys economics and health economics and nursing, I'm really not to the level that she's doing it. I'm really keen to hear what she has to say. I think this will, for those of you who have not heard or joined the Global Book Club, which was Catherine Trebek, who is an economist, political economist, and discusses the well-being economy and capital, etc. Those that might be useful if you're interested. If you're attending today, please look on our maybe Hannah can perhaps put the link in the chat, but we have recorded all our sessions. And that we did 2 sessions on Global Book Club with Catherine Trebek, who's from Australia. And they were really fascinating, and our early career nurses engaged. In fact, Aaron, I think you took part in that. I think you were part
Yes,
of that.
yes.
Yes, you were. Um, so that's one to watch. It should be on our YouTube channel, but Hannah perhaps will be able to find that and put that in the chat. Please watch it. And I guess while we're waiting, we can maybe just mention the State of the World's Nursing Report, which is due out on International Nurses Day, which is May the 12th. Those of you who are nurses or within workforce, etc., you'll all be very excited to see the launch of that report, where we will see the updated data from the member states. And Nursing Now Challenge across its regions are having launch events. And yes, to celebrate what will come out of that, what will be the key messages that we can take forward and engage and create with policy dialogue for investment and better working conditions, etc. Whatever will be the key messages, we will hear soon in May. And I know ICN will be launching their report just before, I think it's next month, they will be launching their big report. And they have been co-partners, co-chairs for the State of the World's Nursing Steering Committee, Howard Catton and one of our colleagues. Here's Olga back. Wonderful, excellent. Back
Come
to you,
back.
Aaron.
Yes, let's start today's
So
session.
sorry.
No worries.
I'm actually traveling right now, so I was trying to zoom off of my phone. So that's what's happening sometimes. It drops off. I hope it doesn't happen again. am I ready?
Yes.
Okay. Okay, so thank you so much for the wonderful introduction. I was really enjoying it because you were very generous in the description. So I'm gonna share my presentation. And there you go. Great. All right, so it's my pleasure to be here. It's an honor and a pleasure to be here. I am looking at all of the people who are joined from all over the world, and it really is a fascinating audience. I'll talk today about the human capital approach to nursing value and payment, and this is the work by my team that has been developing over the course of probably good 10 years, and finally is now sort of coming out in print and getting getting to see the world. So what my team set out to do is to measure the individual contributions of nurses to patient outcomes. And our research really rests on a very significant foundation of evidence that nursing at the hospital level, measured by characteristics of nurses who work in a particular hospital, is associated with patient outcomes, as well as when you measure characteristics of the nursing staff at the unit level, there's also a strong association with patient outcomes in the unit level. So what our team set out to measure is to figure out whether there are differences in individual nurses in the value of their contribution to patient outcomes. And really the foundation and what determined the direction of our quest is this idea that nurses are all the same, right? And nurses are disposable. They are, you can measure nurse staffing by the number of full-time equivalents or hours per patient day, right? Because when you look at nursing this way, it really makes nursing a labor input or more like a commodity, right? That's being used in production without differentiation and due appreciation of the uniqueness of each individual nurse, each individual provider. We really started to look at this idea of are nurses all the same? Is nursing a labor input that's measured by its cost? Or are nurses all different? And with the uniqueness of each individual within the profession, it strengthens the entire profession and strengthens the contribution of nurses to patient outcomes. And those are two very different approaches, right? Because when you think of nursing as an input, sort of overhead, you're seeing the cost of it. You're seeing nursing on the cost side of the equation. And viewing nursing as a costly input makes organizations want to minimize the cost, right? If you think about driving a car, if nurses are thought of as gasoline to the car, then you try to find the cheapest gas that will take you, where you need to go, right? So it's not important. The quality of gas is not as important. The brand of gas is not as important. As long as you can put it in the car and you get it cheap, you're good to go. However, if you think of nurses as key components, structural engineering components of the car, or even if you think of nurses as the design, as the person behind the wheel, or even the designer of the car, then the respect and the understanding of the value of each individual nurse becomes a lot more important, right? So which is it, right? Nurses are traditionally viewed by our healthcare system, and that comes back to all of the sort of economic theory that looks at labor as something that's measured by hours of work and wages, right? And not at human capital that's embedded in each individual. So the idea was to see, can we find differences among individual nurses quantitatively, measure and demonstrate differences in the contribution to patient outcomes among individual nurses who work on the same unit within the same hospital. So our team was the first research team to employ sort of metadata and big data analytics to try to identify patterns of differences in patient outcomes among individual clinicians. So the way that we conceptualized our model was what we call in economics the production function, right? So you see patients as they, on the left-hand side, patients go through the production function, right, through our healthcare system, and they get assigned to clinicians. So then you
I'm
can look
sorry.
at.
I'm sorry, Olga. I think the presentation is frozen.
Oh, well, it's clicking for me. What slide are you seeing?
The front page, like the
Oh,
first
you
slide.
are?
Yes,
Oh,
it's not on
it's
view.
not advancing.
It's not on view. So we're seeing your slides at the side because it's not in the view mode, and it's not moving either for us.
Well, that's really interesting because I am actually viewing it. I am advancing the slides and viewing them in the presentation mode. So, so
I
you're just
wonder.
seeing, okay, so if I go like this, are you seeing the slides? Am I switching the slides now?
Yes.
Yes.
Okay,
Yes.
I'm
Yes.
just gonna go do that.
Thank you.
There's
Thank you.
something that's, okay, so thank you for letting me know. And apologies for all of these, the trouble that I'm having. Right, so that's the first slide that I was showing in terms of sort of the past history of how nursing has been conceptualized and its contribution to patient outcomes, as measured at the hospital level, measured at the unit level. And our team was the first one to set out on this quest of figuring out, do individual nurses contribute to patient outcomes by looking at the links between nurses and patients with the electronic health record. I'm going to quickly show this slide that that was the background for my conversation about the differences between nurses as being viewed as a labor input measured by its cost versus a profession strengthened by the diversity of unique strengths and practice patterns of individual nurses that's measured by the value contribution of this profession to patient outcomes. And I just moved over to this slide, which you cannot see all of the fancy animation here, unfortunately, but this is just to say that our big data analytic approach used the electronic health records from a large healthcare organization to create the links between individual patients, not create the links, but capture the links from electronic health records between individual patients and nurses who took care of those patients. And then we were able to to view how patients are assigned to nurses and view patient outcomes at the individual nurse level. So we have this large data sifting mechanism program that adjusts for a number of patient characteristics and just looks at adjusted outcomes in the buckets that are assigned, in the buckets that are associated with each nurse, as well as all other physicians. We have physicians, we have respiratory therapists, we have a lot of other types of clinicians here. And what we're observing here is when you adjust for all of the patient differences, two nurses are working on the same unit with the same types of patients, right? These are all individual connections, individual times that a nurse puts his or her hands on the patient. You see a significant difference. That's what we were able to observe for the first time. You see a significant difference in the outcomes as measured at the individual nurse level. And that really was evidence that nurses are different in their approach to patients and the way they practice their care, and then in the way that reflects on patient outcomes. When we created this distribution, so this is for that same hospital where we pulled individual nurses. What you have here, each bar here is, this is the frequency distribution of patient outcomes, and the particular patient outcome. In this case, we looked at the change in the clinical condition from admission to discharge, with the higher, bigger change indicating a bigger improvement during hospitalization. And this is the frequency distribution of those adjusted improvements in patient clinical condition during hospitalization as they're pulled at each individual nurse. What you're seeing here is that there's a lot of nurses here in the middle. This is these are the tertiles of the distribution. So each one of them is a third of the nurses. There's a lot of them. You see the really narrow, tight middle, right? Which is what we would want to expect. And this is what you would want to see if all nurses were the same, right? This is the only thing that we would see in the distribution if our null hypothesis that all nurses are the same was true. However, we see a very significant difference in like a swing on both sides of this distribution with nurses in the first tertile, the top 33% of the distribution, having significantly different and better outcomes than nurses in the middle. And there's also a significant distribution of nurses at the bottom of the distribution, the bottom tertile, where their outcomes, patient-level outcomes of the patients to whom they were assigned are considerably below, less good than the outcomes of the other nurses. So that really does show that a nurse is not a nurse, right? And that we should be able to use these data thoughtfully to try to figure out what distinguishes these nurses who are in the lead, right? And how can we learn from them so that how can other nurses learn from them to significantly shift the bell curve to the right? As well as when you look at the nurses who are in the lag here with sort of statistically significantly poorer outcomes, patient outcomes than other nurses. What is it? What is it that's holding them back, right? And do they even know? Do we even know that, do these nurses even know that they're below the distribution? How can we, in a manner that's not punitive, right? It's not about getting rid of bad nurses. It's not about that, right? But how can we use these data to learn what star nurses are doing well, and and help nurses who have maybe gaps in particular, in particular outcomes. How can we help them improve? So that led us to think about nurses as not a nurse gasoline car. Nurses are really professionals whose contribution to patient outcomes is determined by what we call in economics human capital. And human capital is basically a set of all of the characteristics that's embedded in each one of us, right? That's your education, professional training. These are your talents and skills. This is your level of expertise and type of expertise, and also a combination of innate qualities that are embedded in each one of the individuals. So when we'll think about areas, workers that are pushing buttons or moving things in a mechanical fashion, I'm getting the message that my connection is unstable. Human capital in that setting does not matter as much as the ability to perform physical labor. But we were able to demonstrate with our data that nurses are not that, right? The human capital that's embedded in each nurse clearly is important to the nurse's ability to deliver high quality, safe patient care. So then in terms of the value of nursing, when you understand that nurses are not just a labor input that's measured by hours and FTEs, and rather nurses are, each nurse has a unique human capital that needs to be developed, then the value of nurses becomes not the old sort of a cost equation, which is what we've been using to apply to or to measure the value of nursing for decades, right? It becomes a very different equation. The old outcomes over cost equation that's over here. When you measure the value of nursing this way, then the way to improve the value is to reduce cost while also still expecting nurses to maintain good outcomes, right? And this old equation does not link does not implicitly have the link between how much you invest in the nursing workforce and how good the outcomes are going to be. Instead, we decided to redefine the value of nursing as a return on investment in nursing human capital, right? It's a very, very different approach. With the old definition of value, to save or to improve the value of nursing, you try to minimize the cost and expect nurses to do a good job. With a new definition of value, and this is the work that was supported by the American Nurses Association, as well as the International Council of Nursing. The value of nursing becomes the return on investment in nurses, right? So the more you spend and the more you give, the more you get, right? And if you do not give a lot, you're not going to get a lot. It's a very, very different approach, right? So maximize value under the old, or what you can say current definition, you cut nursing cost. To maximize value in the new definition, where nursing is a human capital, you have to invest in nurse human capital, invest in staffing, invest in nursing practice environment, so that you can maximally empower every nurse to deliver the best care they can. I'm gonna quickly move to the next slide. All right, so I will briefly introduce this model. That's the sort of visual depiction of our idea of the value of nursing as a return on investment. Right, the human capital, nursing human capital gear is the moving gear. It's the pivotal cornerstone gear. When this gear rotates, it moves the entire healthcare system forward. Now, we depicted the healthcare system as two components: the production side of it, right, that's where health systems are, and they're employing nurses and other inputs and other labor and other as well as technologies and equipment and all of that to produce patient outcomes, to produce healthcare. Right, so this is the production side. And the financial side is where organizations get revenue, receive revenue in terms of reimbursement payments, and they invest this revenue in their budget. And it's a full cycle, right? When nursing human capital is enabled, when nurses are enabled to, through the process of care delivery, produce healthcare services, that are accessible, high quality, and cost effective, right? That improve consumer outcomes, but it also becomes reimbursed and becomes a revenue for the organization. Organizational revenue improves organizational outcomes, right? And that's the market share, the financial sustainability, reputation, all of those things. And organizational revenue through organizational prioritization of finances goes into the next cycle, right? It goes as expenditures into physician labor, as well as medical equipment, as well as pharmaceuticals and all of this. But there's the big part of it is the nursing budget. And how much of this revenue becomes reinvested into the nursing budget determines the next iteration of this model, the next iteration of the cycle. In a lot of healthcare economies, what we're suspecting now, definitely in the United States, the connection between organizational revenue and prioritization of resources and funds to the nursing budget is broken, as well as the sort of the size of the nursing budget is not sufficient to optimally support nursing human capital development and move the cycle forward. And that's what we need to fix. We need to understand with the human capital approach to nursing value and payment, we have to understand that it's only through investment in nursing human capital that we can have a financially sustainable, high quality, effective healthcare system. I will tell you a little bit about some of my new work that just got published 2 weeks ago, maybe a month ago, about the potential impact of artificial intelligence on the nursing workforce, as well as nursing's ability as this key cornerstone gear to improve patient outcomes and organizational financial sustainability. We know that there are a lot of, there's a significant potential for artificial intelligence to improve and augment nursing care. We already know, and I don't know how much it is introduced and how much you've seen it internationally, but in America, there's the ambient documentation technology is being tested in a lot of healthcare settings. In fact, I just had my appointment 2 days ago with my own nurse practitioner for my regular checkup, and she had an iPad with her, and she got my consent to have our meeting transcribed by ambient documentation. And I cannot tell you, about a half of our meeting, she was raving about this technology. She loved it. She said, it allows me to have a conversation with the patient. It allows me to really understand and listen to the patient versus typing things in the box. And what the technology was doing, literally just listening to our conversation, automatically scribing everything that we were talking about and putting it in the boxes where it should be, for the record of the visit. We know that documentation right now takes about 40% of nurses' time. And at the present time, artificial intelligence can artificial intelligence can already free up about 15% of the nurses' time. And this 15% will undoubtedly grow as artificial intelligence becomes more and more advanced. What can nurses do with the extra time? Obviously, research shows that what nurses want to do is to provide more time and spend more time holistically caring for their patients. They also want to help their fellow nurses. When nurses are so strained in the workplace that they only have time to take care of their own patients, they are missing the opportunities to help out other nurses. They're missing the opportunity to teach, educate younger nurses, right? And that's something that nurses report as being very important to them if they had more time to be able to engage with the other nurses in the unit, help and mentor others. And obviously, there is an opportunity through all of this to improve patient care. However, what we worry about is the potential of artificial intelligence to replace nurses. And these are just some of the pictures that I cut out of NVIDIA is the company in the United States that produces artificial AI nurses. Now they call them AI technicians, who are advertised as nurses, and they have personalities, they have names. None of them are real, but they have personalities, names. They have specific areas of expertise. For instance, Nancy is pre-op colonoscopy, and Keisha is congestive heart failure discharge. And there's also a description of sort of their personality, right? Nancy is direct, and Diane is engaging, and the cost is less than $9 an hour, right? So that scares nurses. It scares patients too. When I see this, it's a little scary, right? Because in America, for sure, and I would dare say in a lot of countries, nurses do not trust their hospital or their employer to implement artificial intelligence or any new technology in a way that does not harm and instead improves patient care. So we know that 60% of nurses do not trust their employers to prioritize patient safety when implementing AI. We also know that a lot of nurses, a lot of health professionals, one out of four in general, are worried about artificial intelligence replacing them at their job. But nurses are significantly more so than physicians or other health professionals concerned about being replaced by AI. So in this research, what we were trying to figure out is how likely are nurses to be replaced by AI versus benefit from their work being augmented by AI. And what we know now is that artificial intelligence is good at replacing technical skills, things that are standardized, like standardized decision-making, evidence-based decision-making, memory-based learning, right? Where you have to memorize and keep in your head a lot of things. AI is really, really good at that. Checklists, predictable, repetitive, monotonous tasks. We know that AI is not very good at intuitive decision-making. If they're not trained for a pattern, right? AI is not going to be able to intuitively figure out the situation and make a decision. They do not have a human lived experience, so they're less able to connect with individuals on the level that cannot be programmed that, one size fits all, or maybe a few sizes fit all. AI is not able to form a human connection. They're not perceptive outside of the coding behind them. And most importantly, AI is not built in the way humans are. They do not have nimbleness and they do not have dexterity at this point in time. So when you look at the nursing profession or any profession to sort of figure out the risk of being replaced by artificial intelligence, we have to see how much the particular occupation, and specifically for nursing, how much it relies on technical skills or hard skills versus human skills, soft skills. And the more the profession relies on human skills, the more human skills are important for it, the less likely the profession will be to be replaced by artificial intelligence, and more the profession will be to be augmented and empowered by artificial intelligence. So we use some data from the Bureau of Labor Statistics in the United States to figure out, to get skills that are needed for skills and types of expertise that are needed for nurses. And you can, from that website, you can get skills and knowledge required for any occupation within, I think there's 2,000 occupations there, or maybe even more. So we looked and we created those what are called spider charts. A spider chart is basically a circle that starts in the middle and goes out. On the outside of the circle, there are different types of skills. I have 4 charts here, one for nursing assistants, one's for licensed practical and vocational nurses, registered nurses, and nurse practitioners. So the skills that are on the outside form sort of this area in the middle that signifies how much the skills are needed for this particular occupation. On the right-hand side, in the green area for each chart, I listed skills that are human soft skills, and that's critical thinking, active learning, service orientation, persuasion, negotiation. On the left-hand side, there are listed skills that are considered harder technical skills, and other programming, finance management, operations analysis, and things like that. And then we looked for the for each profession how much those skills are needed for to do the job. And you can see that 2 things from this chart. First is that all of the nursing professions are heavily skewed onto the green area, right? Soft skills are what really defines every nursing profession, from nursing assistants to licensed practical nurses to registered nurses to nurse practitioners. The other thing that's also obvious is that more skills are required as you move up the level of nursing of the nursing profession. Nursing assistants require fewer skills in general to perform their job compared to licensed practical and vocational nurses, registered nurses, and ultimately nurse practitioners. But what unifies all nurses is that the area on the green side that's indicative of the importance of human skills is a lot more important than the area on the purple side that measures the importance of hard and technical skills. So from these data, what we can see is that nursing is not likely to be replaced by artificial intelligence or technology, and rather nursing is more likely to be augmented by the introduction of artificial intelligence, right? If artificial intelligence takes away or replaces nurses in these hard technical skills, and nurses are able to spend more time with the patients, active listening, critical thinking, persuasion, negotiation, that will empower nurses and not dilute nursing. So when we're thinking about the impact of artificial intelligence on the healthcare system, and I just depicted 3 types of stakeholders or employees within the healthcare system: nurses, physicians, and administrators. A lot of people are worried or thinking that when artificial intelligence enters the healthcare system and grows its roots there, it will negatively impact nurses. It will make it fewer nurses, fewer physicians, and a lot more administrators or IT people and all of that. However, what I think really could happen is when AI enters the healthcare system and healthcare practice, it will empower nurses and will make more nurses, right? And it potentially could replace some of the physicians if nurses really start, if the empowerment of nurses really allows them to practice at the full scope of practice, right? Because we know, in America at least, advanced nursing providers, nurse practitioners, have similar scope of practice to physicians, right? And they are relatively less expensive in terms of
think we may have lost her a little bit again. But Aaron, how fascinating is this, everyone?
Still like trying to absorb the
I know.
informations.
I know. I will definitely need to listen to this 2 or 3 times more. There is so much content, evidence-based content in here, and really, I would suggest cutting edge evidence. We are kind of on the edge of this area. I know the work we've seen at Penn by Linda Aitken and the team around that first part around the importance of the nurses and what work they're actually doing and how that links to patient outcomes, but this with a different lens with this piece of work. And then now, this idea, this whole piece around human capital, that art and science bridge and the technology. I mean, there is so much here. And I was thinking, I wish governments were listening to this webinar. And if I was the chief nurse, I would be wanting to hear this stuff. So everyone, if you're listening, you know, this is recorded. Please direct others to it. I know by the look of it, we've got probably some senior people in this audience, but all of us, this is really, I would consider myself quite knowledgeable about most things that are going on in nursing worldwide. And this is at the very cutting edge, for sure.
And yes, this is recorded and this will be uploaded to our Nursing Now Challenge YouTube page shortly after. And yeah, so Dr. Yakusheva right now is, I think she's the celebrity in a sense, which I'm very thankful that she agreed to speak on this
Wow,
subject today. And please
wonderful.
do take a look at her articles that I posted,
They
that
are
I have put in the chat box. Both of them are open
lovely.
access, so you can
Fantastic.
access
Yes, everyone
those
read them.
articles.
This is wonderful.
Yes, and
Olga, she's back.
And
we
I
will
am
come
back.
back.
We're just
You would
saying how amazing you are. We are just thrilled, and we're just saying we're kind of trying to absorb all this information
We're
and thinking
mind
about.
blown.
We're mind blown
Well,
because this needs to get out there. It's absolutely cutting edge. It's wonderful. Thank you. We're loving
no,
it.
of course. And you would think I'm in space, but I'm not. It's that just for some reason the connection is bad today. I have many apologies. I tried to.
Oh, please don't. Please don't
No
worry.
worries.
Okay.
Yes, people are saying
So
in the chat, this is absolutely fascinating. It's so important. I could listen to more. It's so interesting. So please take over from where you were before.
so I think I'm just gonna, in the interest of time, I think I drew the two potential, futures with AI being integrated into healthcare and talked about the importance. If this is where you heard me, I talked about the importance of for nurses to really participate in the development of AI, really embrace the integration of artificial intelligence in nursing, so that we can see the future where nurses are empowered by artificial intelligence and not the future where nurses are replaced by it. In the interest of time, in the interest of time, I think I'm just going to quickly go to some of my concluding slides. So today's challenges and opportunities. We all know that the healthcare is really challenged globally right now. We know the finances for healthcare are volatile. Healthcare organizations are struggling with the ability to have a secure funding and sufficient funding. We know that the challenge is access of many patients in the United States and globally to appropriate, safe, and high quality care. Now, when there are challenges, there are always opportunities, right? Today is an opportunity like no others for nursing, because nursing is key to both quality of care and economic outcomes within the healthcare system. And right now, nursing is not leveraged to its full capacity. We know that organizations and healthcare systems and global systems, health systems within countries are not leveraging nursing, right? Nursing is being viewed as labor input is costly, it's being oppressed, it's being suppressed, it's being minimized. This is the wrong approach, right? Really, healthcare systems will thrive if they invest in nurses. So the actions that nurses must advocate for is making healthcare more nursing intensive. And by nursing intensive, I mean, if you look at the different types of professionals and different types of inputs that it takes for a healthcare system to produce health outcomes, we need to make it more nursing intensive and less technology intensive. And less old technology intensive, right? Nursing is where it all is. Nurses are the most populous profession, and also the profession empowered by artificial intelligence with the most opportunity for delivering high quality, effective, and cost-effective patient care. We need to enable advanced practice nurses to practice at the top of their license, and all nurses. What we're seeing in the United States and globally is that the scope of practice for nurses is sort of going up, which is what we want, but nurses are starting to practice less and less and less within the optimal scope, and they're more relegated to the lower level of their scope of practice. We see in the United States nurses doing jobs that do not require a nursing degree at all, like they're sterilizing instruments, right? And they're bringing food to patients. That's not registered nurses doing this, so should not be happening. And we must invest in artificial intelligence that supports nursing, not replaces nursing. And really, my concluding slide is investing in nursing, and investing in nursing human capital is a path to success. Not investing in nurses is a path to failure. And organizations must understand that, and countries must understand that. And nurses must really move along with this agenda of advocating and measuring their contributions to the healthcare system, to patient outcomes, and to the financial outcomes within the healthcare system, and really advocating for more investment in the nursing workforce so that organizations can thrive, and healthcare systems can thrive, and healthcare economies can thrive, and ultimately patients can thrive. So that is my last slide, and we have a little bit of time for questions.
Thank you so much for your presentation. It's fabulous. It's some ideas that we want to reach as many people as possible. Right now, nursing as a whole, we are facing the challenge. We are facing a lot of even hostile situation towards us, and it's at these kind of moments we need to stand together. We need to advocate. We need to make real changes, and we need to be the change. So now, please, if there's anyone has any questions that they would ask, you can pop it in the chat box, or you can unmute yourself and raise your question. And once again, I would like to remind you all that I have put both articles of Olga's work is available online, open access, so please go and read it. And there's a 6-part series on value-informed nursing, which is also nursing practice significantly influential. Please do give it a read. I can see there's people raising hands. Aisha, do you want to go?
I'll let Marion go. I have a question, but I can wait. I much prefer if people who are attending are able to have that conversation.
Yes.
So leave me to last.
Sure. So Marion.
Hello.
Hi.
Hi, Marion.
Hello. Thank you so much for this. I'm thinking of philosophical and economic models now, and when we're starting to use the term capital, we have political and philosophical lenses on this. So I'm wondering if you've extended this to go kind of have a feminist theory on it, really, because nurse labor is predominantly female labor, and that sort of therefore that hidden idea of what counts as capital changes. So have you got that sort of feminist lens on it as well, or could we start to talk about that offline?
Yeah. So one of my biggest critics, and I love to have critics, but one of my biggest critics is the group that criticizes me the most is sort of the feminist approach, feminist theory, and particularly the idea that capitalism isn't isn't an optimal framework for maximizing the contribution and the value of any human, right? And the reference to the nurses as human capital feels, from that perspective, feels belittling. And it also feels possessive, right? As if we want our healthcare system to own nurses and treat them as capital. And I totally understand this perspective. And I will say that I was born and raised in Kazakhstan, which was one of the former Soviet Union countries. And I was raised thinking that capital is bad, right? Anything that relates to capital is, it's from the West. It's all of those bad ideas. And here in socialism, we are, we're good. We're about humans. We're about values. We're about, the right thing. We're not about money. So I understand, I fully understand that perspective. My response, well, I mean, I have two responses to that. The first one is that regardless of how we feel about capitalism, we are living in an environment where, in the United States particularly, where a healthcare system is market-driven. We do have money that decide everything. And we might not like it, but as nurses, we must work within the system to advance ourselves and and advocate for patients. And that's sort of, it's hard, it's hard advice, and it's a difficult realization, right? Because I think we would much rather not have it that way. And we would much rather criticize the capitalistic approach and the money-driven economy and the pursuit of healthcare organizations to have revenue, right? We much rather criticize it and say that we would not want to have the system, ideally. But criticizing it does not help really to improve nurses' position within the system that it is, right? We need to have solutions. Nurses need to be able to advocate for themselves, right? And the only way to advocate for yourself within a system that values revenue and values resources and is driven by financial considerations is to learn how to speak that language. You don't have to like it, right? You don't have to be for it. But because you have to work with people and people who make decisions about nurses and about patients, and they're driven by this revenue, profit, capital model, right? You have to understand this language so that you can articulate what you want in their terms. It's like motivational interviewing, right? You want a patient to quit smoking, you got to talk to them in the language that they understand, and align it with the priorities that the patient has, right? Otherwise, you're not going to get them to change the behavior. So this is the situation where I feel like nurses must, if anything, if we want to change anything, right? If nurses want to change the situation, it's been this way for a long time. Nurses have been objecting to capitalism, and feminist nurses have been objecting to the idea of capitalism and the capitalist-driven healthcare system since its inception. It hasn't helped us to change anything, right? So I am proposing that nurses learn the language, understand the motivations, and engage with those motivations for the benefit of themselves and their patients, right? Because nobody will change the status quo in the healthcare system. It benefits everybody besides nurses and patients. So if nurses want to improve it, if nurses want real change, that language needs to be engaged with and not just hated on. I will also say that the idea of human capital, the term human capital in economics might be misguided, right? Because we really aren't thinking about human capital as the organization owns you, right? The idea of human capital is something that each individual possesses. So every nurse brings his or her own human capital to the workplace. If they leave the workplace, they walk out, they take the human capital with them. They're not owned by the organization. In some ways, they come to the organization with what they have, right? It's being treated, it's being viewed as not just a body with a heartbeat and the ability to check off boxes and do manual tasks, right? It's coming to the organization with this enormous amount of education, experience, expertise, talents, unique to each individual, and transacting with the organization and looking to be valued back by the organization for what you bring, right? So that's the idea of human capital in economics. And yeah, but there's definitely, the terminology is causing both misunderstanding as well as did I answer your question?
Yes, and I agree with you, and that this idea of now is trying to inculcate circular economics or donut economics, but we do need to, the feminist way is to find the common language and then move from that, isn't it? You know, collectively. So yeah, I'm with you. Thank you for putting that together.
Thank you for asking this question too.
Welcome to Joel.
Yeah, thank you. So my question's a bit of a follow-up to that, Dr. Yakusheva. So yeah, I mean, so we're talking about how nurses traditionally have had less discretionary disposable income, and to Marion's point, a lot of that has been tied up in the gender dynamics of the profession. I'm a nurse myself, obviously not a woman. So you know, as your evidence is showing the economic value of nurses and driving healthcare systems, and you know, in some of your models, you talked about how nurses and especially nurse practitioners practicing at the top of their scope will actually be able to shift some of the burden of care in our health systems, can become you know, a bit more encompassing of nurses than other professions like medicine, you know, is the obvious example. Do you see some revenue starting to, or reimbursements or economic capital starting to shift to nurses as individuals, which would allow them to have larger amounts of disposable or discretionary income, which they can then translate to that, you know, that political capital that we all seek so much?
Well, no, that's exactly the point of it, right? Even if we go back to feminism, and when we think about how women were able to, you know, to get the political power that we have now, right? Historically, it's their economic empowerment, right? When women started working and making their own pay, it's when women fought for, and still fighting for, equal pay for equal work, right? Economic empowerment is a vehicle, is a ladder to political empowerment. And that's, I mean, that's unfortunate, but that's how it is. And that's how I view this work as really a pathway for nurses to use economic empowerment to do the right thing, right? And that's, you know, it's up to you. And that's where I'm not a nurse by training, but I want to show a pathway that I think will work for nurses to gain the seat at the table, an equal seat at the decision-making table, maybe even a seat at the top of the decision-making table, right? So economic empowerment is not the end goal. It's a means to the end goal of having the decision-making power and the influence that nurses must have in order to practice, to have autonomy over their practice, in order to be influential in the decision-making space, in order to be able to advocate for patients and decide what's best for patients, right? And that's what this work is all about.
Well, with the time restraint, I will quickly use our program director's question. Is there one piece of advice for action for us to engage after we leave this discussion?
Unite. Because I will say that I've noticed that you put two nurses in the room and they will never agree on anything. Like, I'm joking and exaggerating, but nursing is this enormous coalition. In America, 5 million people, right? And if you think about yes, nurses do not have the financial resources, but they have the human resource that's incredibly politically powerful, right? For the 5 million nurses that are out there, a lot of them have partners. So make it 8 million people who are for nurses. Add children and parents, that will become 20 million, right? Add all of the people whose lives have been touched by nurses, right? And it's adding me there, right? It's an enormous coalition, not just in the United States. Globally, nursing is an enormous political coalition, an enormous power, if it could just coalesce around certain goals. And so nurses must unite and set an agenda and reach that and fight for that agenda.
This is a very powerful statement. We have to unite. And I want to thank Olga again for enlightening us with today's session and all of you attending. So this recording will be shortly on our Nursing Now Challenge YouTube page, and we are preparing to launch a whole series on the State of World Nursing Report, launched on the International Nurses Day in May. So please keep. Sorry, I'm a little bit tongue-tied right now, but thank you all once again, and please I want to show so much gratitude to Dr. Olga Yakusheva.
Thank you.
Please,
No, and I wanted to thank you all for the opportunity to speak to such an amazing audience. And Tsung-Po, you have organized everything and reached out to me, and you have been such an advocate. I really appreciate everything you were doing for nursing, and everybody who is on the Aisha, that was my pleasure to meet you. Thank you to the entire audience. And
Thank
it's
you.
just been an honor.
You've not heard the last of us. You're a special person for us.
I can be here anytime you want me to.
Wonderful.
So everybody,
Thank you.
if you
Well done.
reach out.
Yes.
I love talking to people. I love talking to nurses, and let's unite. Let's do something together.
Let's do it. Yes, yes. And well done to our Western Pacific hub. Fantastic. We have 6 regionals hubs. They're all smashing it, all led by early career nurses. And they are doing it. They are uniting us. And Olga, inspirational today. Thank you so much. Thank you, everyone. Have a wonderful morning, day, evening, wherever you are. And speak to you soon, Olga. Thank you.
Bye now.
Bye.
bye.
Bye, everyone. Thank you. Well done.